Hey friends, welcome back. My name is David Rice. I'm your chief editor here at DentistryIQ, and I am here with great friend and colleague of mine,
Amber Auger.
Amber. How are you today?
I'm great. How are you?
I'm doing really well too, and I'm so excited to be here with you because of all the people I know in dentistry, you are one of my favorite because you talk science and you've learned to, bring emotion to patients so they feel safe and comfortable, but really how to bring that science piece to the table. And we've got some things that are happening today from a material standpoint and a prevention standpoint that kind of begs our help. So let it rip.
All right, no pressure.
No pressure.
Well, no pressure. Well, I will say it's always so important to look at the patient's needs. So when I practice clinically, what I'm looking at is the pH of the mouth, the biofilm control. I always want to be selecting products that really train the biofilm to work effectively. So how we're elevating that pH, what we're choosing to kill the bacteria and to prevent it from growing. And of course, we always want to be supporting that oral microbiome. So what that looks like for me is products with xylitol in it, thinking differently and comprehensively of a calcium and phosphate. And if a patient is adverse to a fluoride, what can I go to? So for me, that's going to be an arginine product, and really training the patient on how to balance that pH throughout the day as well is essential.
That's so important because I think in dentistry, change is hard. And it's not that what we've had in the past is bad. Clearly, we've had some wonderful fluoride-driven products, but you raise some interesting chemistry. And tell me, patients walk in, you're trying to control pH, trying to get this biofilm, you're trying to get their body, train their body. I love how you said that. What are some of your favorite products and tech that you bring to your patients every day?
Great question. Thank you for asking it. I'm always looking at what is currently in the mouth. So I want to identify the saliva ability to buffer. So I really love the GC America buffer kit that they have, because I also am looking, if a patient has a white spot lesion, we know red alarm, how do we prevent that from progressing? If that patient has an acidic pH, if they're not able to buffer, if without saliva being stimulated, they're at a high risk, we know that we're going to keep a closer eye on that and be thinking of how we can treat that at its earliest stages to prevent it, again, from progressing. But then I'm also looking at what pathogens are in the mouth from a periodontal standpoint. So there's some amazing tools out there, from salivary diagnostics with direct diagnostics, from oral DNA. There's so many different companies, but looking at how they're different. And for me personally, we just started implementing direct diagnostics. So we're targeting those top 5 periodontal pathogens, and it's twofold. So if that patient does have acidic pH and has those periodontal pathogens, we know that they're going to be more active in that area and more destructive. So that's really where we're looking. We're also looking at the biofilm management and how we're educating on that biofilm. We're disclosing the patient. We're showing them how to use whatever we're recommending. And it looks different for every patient every time, because we can't just simply recommend one product. It's not going to work for all of our patients.
It's so very true. And it's fascinating. We've been, down that oral DNA path for, gosh, it's got to be almost 10 years now. And it's phenomenal, like you said, to really customize your care based on what your patients bring to us. It's incredible how much more healthy we can bring them. So I also know you're a big fan of a few products from VOCO. They're different. Tell me about those.
Yes, so I love VOCO products for many reasons. They have the Riemann Pro, and the Riemann Pro is a higher fluoride that does have xylitol in it. What I also love about it is it's the perfect consistency, in my opinion, where it's not a real gritty paste, but it's also not so smooth it'll ooze out of a tray. And I love to have my high-risk patients take some of that Riemann Pro and rub it right into the tray and use it in their Essus retainers, use it in a night guard, rinse out in the morning. And that creates a really great way to balance the pH, especially if they have moderate to severe xerostomia. Overnight, we're again training that biofilm as they're sleeping. And then they also have some amazing fluoride products. So they have an amazing varnish called Profluorid that is absolutely fantastic in its ability to release xylitol over time, that it also is a great consistency that patients want to keep it on longer, and they all taste great. So who doesn't want a fluoride that tastes great? Another thing that they have that most people don't know about, at least from, in my opinion, most people don't know about it, is a light curing desensitizer called Admira Protect. And this is one that I have recently fallen in love with. We recently did an article for Dental Economics on it with case studies with my patients who come in with that sensitivity. They have that clinical attachment loss, and they're periodontally involved. So this is allowing me to treat the patient once and they're comfortable. And I have one clinical case that's been up to 2 years that they haven't had sensitivity. And this is a patient before that I could never even, I felt, effectively debride the area because there was so much discomfort.
I love all of those things. And I would piggyback on what you just said for that last desensitizer isn't it nice to be able to treat somebody today and know that we actually have products out there now that last a long time? Because, our patients, even though we try our best to educate them, they don't always understand that we're not curing them per se. We're, periodontal diseases with them, and our job is to help them manage it. So
Right.
Science over emotion. Friends, I know you're all following Amber, but if you're not, please come up from under that rock and do so. Amber, what's the easiest way for people to reach you?
Amber Auger RDH on Instagram, amberaugerrdh@gmail.com. And I look forward to hearing from all of you.
Awesome. Thanks, everybody.